Welcome to the Faculty of Dentistry, Universitas Padjadjaran, with the concept of smart and green dentistry.
The Faculty of Dentistry, Universitas Padjadjaran, has two large campuses in the Jatinangor educational area and the central area of Bandung. Both are comfortable and safe areas with convenient access to transportation.
The Faculty of Dentistry, Universitas Padjadjaran, applies the principle of good management under the concept of smart and green dentistry, which unites and improves the quality of elements of educational interest as a major force in facing challenges in society, while applying hybrid learning as a combination of online and offline learning system to meet the demands and the needs both national and international society.
Our faculty has 11 departments, represent different expertise which comprising the bachelor degree in dentistry program and dental professional education program. We also offer 8 dental specialist postgraduate or residency programs, Magister of Dentistry program, and Doctorate of Dentistry program.
In facing the global challenges, we conducted the transformative learning to generate excellent graduates in the fields of dentistry, highly competitive at the regional and global levels, professional, while always practicing the noble values of Universitas Padjadjaran. Therefore, we have implemented an outcome-based education that is adaptive, relevant to user needs, which will ensure the future competencies. The student-centered learning is selected as the learning method through the application of hybrid learning, while also adopts the learning principles of the Merdeka Campus Merdeka Learning. Furthermore, all study programs continuously strive to improve the quality of learning to reach the internationalization. We have research-based products which are ready to be marketed as our tribute for the improvement of the quality of life. We are proud of the achievement of our alumni in the national and international level.
The Faculty of Dentistry, Universitas Padjadjaran, is committed to developing and improving excellent human resources through educational and training on a domestic and foreign scales, and is also committed to improving and providing educational and research facilities and infrastructure that meet the latest technological development.
The Bachelor Degree in Dentistry Education Program is located in the Universitas Padjadjaran Jatinangor campus. It has been accredited A by the Indonesian Accreditation Agency for Higher Education in Health.
Achieved through the mission of providing integrated education, research and community engagement of oral health-related quality of life by following the development of dental science and technology to generate excellent, innovative, professional, virtuous, and internationally competitive graduates.
Student-centered learning through problem-based case studies, such as tutorial activities and project-based case learning in the form of field activities for dental public health minors, and also equipped with learning skills from various courses representing 11 departments with different expertise, which are oral biology, periodontics, orthodontics, oral medicine, prosthodontics, pediatric dentistry, dental public health, conservative dentistry, dental maxillofacial radiology, oral and maxillofacial surgery, and dental material science and technology.
Welcome to Universitas Padjadjaran Dental Hospital. In this hospital, we provide health services to the community. This hospital also serves to the educational process for dental students and residents. Here, they will attend dentistry education and learn to treat patients until they are eligible to graduate as dentists or dental specialists.
Is Universitas Padjadjaran Dental Hospital. We serve as the dental education service facility in the dental professional education program at Universitas Padjadjaran.
Dental Professional Education Program is a continuation of the second stage of the undergraduate program. It is a competency-based study to train students' clinical skills in the management of oral disorders and its application in the community to overcome oral health problems.
Welcome to Department of Orthodontic of the Faculty of Dentistry, Universitas Padjadjaran, and also the Orthodontic Specialist Postgraduate Program of the Faculty of Dentistry, Universitas Padjadjaran.
The Orthodontic Specialist Postgraduate Program trains dentists with orthodontics expertise in interceptive orthodontics, correct.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and regards to our respectful attendees. My name is Sarah and I will be your host today. Before we begin the lecture, please allow me to acknowledge and greet some familiar faces in the audience. I would like to welcome and express my gratitude to our honorable guest, Dr. Saleh Jany, BDS, MSc, HLD, ABLS from Pamlico Community College, North Carolina, for taking the time out of his busy schedule to be here amongst us today. Next, I would also like to extend a warm welcome and appreciation to our respectable Dean, Dr. Dudi Aripin, our Vice Deans, Dr. Sri Susilawati and Dr. Endang Syamsuddin, and all the faculty directors, Head of Dentistry Profession Study Program, Dr. Erli and her team, Head of Unpad Dentistry International Office, Dr. Dewi Zakiawati and her team, and also Head of other departments, professors, and doctors. Thank you for making the time to join us today. Lastly, I would also like to thank and welcome all students and all participants for joining us today. Ladies and gentlemen, as today's lecture is being conducted virtually, I'd like to provide you with a few instructions for the smooth running of this event. The following are the instructions. And thank you for your cooperation. Our agenda today is, first, there will be welcoming remarks from our Dean, Dr. Dudi Aripin, and second, a lecture by Dr. Saleh Jany entitled Advancement in Laser Technology for Oromaxillofacial Surgery with Dr. Indra Hadikrishna as the moderator, and followed by a discussion. And finally, appreciation and documentation, followed by the closing of this event. Before we begin, let us all join in a prayer for the success of today's event. Let us respect each other's belief and pray accordingly. Let the prayer commence. Amin ya Rabbal Alamin. Ladies and gentlemen, now we kindly request your attention as we prepare to sing the Indonesian national anthem and Unpad hymn. Please join us in paying tribute to our country and celebrating our shared value.
Indonesia tanah airku, tanah tumpah darahku. Di sana aku berdiri, jadi panggul ibuku. Indonesia kebangsaanku, bangsa dan tanah airku. Marilah kita bersatu, Indonesia bersatu. Hiduplah tanahku, hiduplah negeriku, bangsaku, rakyatku semuanya. Bangunlah jiwanya, bangunlah badannya, untuk Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang tercinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang tercinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya. Universitas kita, pajajaran tempat bernaung. Di sana di masyarakat, pembina nusa bangsa. Pajajaran lambang suci, alma mater yang tercinta. Tempat ilmu dan cita, alma materku tercinta.
Distinguished guests, now we will have the privilege of hearing a few words from our esteemed Dean. Doctors and participants, please join me in extending a warm welcome to Dr. Dudi Arifin.
Okay, thank you, Miss Sarah Azhar. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, and good evening, Dr. Saleh Jany. I am very pleased today to welcome our guest from Pemliko Community College, Dr. Saleh Jany, for the second time in the guest lecture series. I also welcome the faculty official, our Vice Dean of Academic, Research Student Pair and Alumni, Dr. Sri Susilawati, and then Vice of Human Resources, Dr. Ndang Samsudin, our manager, Dr. Feni, Dr. Nanan, and the head of the Dentistry Profession Program, Dr. Eli, the head of the International Office, Dr. Jakia and team, to our moderator, Dr. Indra Hadi Krishna, Spesialis Bedah Mulut Konsultan, and MC, Ms. Sarah Azhar, and of course, all our beloved student, lecturer, and staff. Ladies and gentlemen, today Dr. Jany will give a talk on advancement in laser technology for oral maxillofacial surgery, especially for our dentistry profession student and all of us here today. As we all might know, laser technology has emerged as a revolutionary tool in medical science, offering precision and minimal invasiveness. In the area of oral and maxillofacial surgery, the integration of laser has significantly enhanced patient outcome and streamlining surgical procedure. Laser can target specific tissue with high accuracy and minimizing damage to surrounding structure. Moreover, compared to traditional surgical methods, laser offer advantages such as reduce bleeding during surgery, which is one of critical factors influencing patient safety and recovery. We all agree that medical innovation like laser technology is here to favor the area of dentistry, especially oral and maxillofacial surgery, for the betterment of patient life. Professor, doctor, and fellow student, without further comment, let's hear more about the laser technology from our guest lecture. Hope you will explore and gain fruitful knowledge from the lecture. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dean, for your kind and inspiring words. We appreciate your presence and support. Ladies and gentlemen, our main agenda will be moderated by Dr. Indra Hadikrishna, SPBMK. Please allow me to briefly introduce him. Dr. Indra Hadikrishna completed his study at Universitas Padjadjaran, then continued his study in the Oral and Maxillofacial Surgery Specialization degree and graduated in 2017. He is currently a lecturer in the Department of Oral and Maxillofacial Surgery, Faculty of Dentistry, Universitas Padjadjaran. He has published several articles, with the most recent one focusing on anti-cancer potential of curcumin in 2019. Everyone, please welcome Dr. Indra Hadikrishna.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Master of Ceremony, dear Sarah Azhar, and good morning, our Dean and all the members, Dr. Dudi Arifin, and especially for Dr. Saleh Jany, our beloved guest lecturer from Pamlico Community College, United States, North Carolina, United States. Thank you for sharing the knowledge of laser surgery with us in Indonesia, especially for the profession or postgraduate program. It's kind of new for us and is still emerging in Indonesia, and we would love to hear your presentation about the laser. Firstly, I would introduce Dr. Saleh Jany. Dr. Saleh Jany is a faculty member of Pamlico Community College, Greensboro, North Carolina, United States. He graduated from dentistry of University of Baghdad, and then she take a master program in maxillofacial surgery in University of Baghdad, and then related to this lecture, he get a higher diploma in laser medicine in University of Baghdad Laser Institution, and he's currently taking the post PhD program in the United States. With no further talking, we would like to invite Dr. Saleh Jany to present his presentation about fundamentals in dental lasers. Please, Dr. Saleh Jany, the floor is yours.
Thank you very much. So yeah, this is my slide. So I think laser is the future for dentistry. Nowadays, there's two things. There's digital dentistry and laser dentistry. 10 years ago, there was the implants. Remember the implant, dental implant was a big hit, and it's coming very big. All the dentists should know dental implant. 5 years ago, there was sleep medicine. Now most of the dentists, they know the sleep medicine. They have these sleep appliances, some surgery we can do
Sorry,
to
Dr.
adjust.
Saleh, to interrupt. Your slides,
You see them?
I can see it, but it's not in a full screen.
Okay. Let me escape. Stop sharing. Let me see.
Okay, you can start the share screen now.
Okay, let's see. How about now?
Yeah, it's great.
Okay,
Perfect.
great. Thank you. Yeah. So let's talk about the fundamental of laser. Laser is the future for dentistry. I know for you, student, it's for you. Remember a long time ago when there was the light cure, and now every day every dentist have light cure. Like I was in the dental school when we used the chemical cure fillings. Nowadays, every dental office has a light cure machine, so you could do light cure. I think the future in every dental office, they're gonna have a laser. Especially that laser is not very expensive, and you can use it for gingivectomy, frenectomy. You can do sterilization of the root canal. You can do it for you can do debulking of tissue, like if you have ulcer. You can do it crown lengthening. You can exposure of implant. All these things you can do it with one machine. And in America, that's if you buy diode laser, you can pay for that within 2 to 3 months. You can pay for that the whole machine. If you buy European YAG laser, which is more, it will take like 6 months to 7 months to pay for the machine. So for all the students, the future, you should know about laser, because if you don't buy the laser, the neighbor or the next door, the next door dentist, he will buy laser. And I have a friend, he's a periodontist, but he has signed his own sign, he's a laser specialist. And people, they don't go to the oral surgeon, they go to him because he has technology. People will always attract to technology. They want technology, and patients will look technology. And always patient look for newer technology, 3D X-ray, 3D printing, 3D these things. It will attract the patient, and if you should learn the new things. You don't wait for the learn things to be enforced on you. So I will have an idea. I will give you like ideas. What's the basic idea? What is laser? What is light? How the laser came through, and when we use it, and the different type of laser can be used in dentistry. So laser in general is the acronym for light amplification for biostimulated emission of radiation. Here, radiation is not X-ray. Radiation in general is a light. So light in general, it become more divine in many cultural, many religious. Bismillah ar-Rahman ar-Rahim, Surah An-Nur. Bismillah ar-Rahman ar-Rahim. Allahu nur as-samawati wal ard. That's mean light. God is light, and Allah yukhrij alladhina amanu min adh-dhulumati an-nur. Take the believer from darkness to the light. So, and even the Bible, God was said, "Let there be light," and there was a light. So light is always divine, and always be fascinated. The human in general, since forever. Life without light, it cannot be done. So light is the smallest energy, a quantity that can be transported. So there's many theories about the light characteristic. Remember the double slit experiment by Mr. Young? It's 1800.
and he proved that the light has a wave properties and the wave interference. Nowadays, they think light is it's both particle and a wave in general. So it looks like a particle move in a wave fashion. It's like a small Aladdin on a magic carpet. But the light is a part of a big electromagnetic rays. The thing we see here, we see only about just tiny part of the whole light, because X-ray is a light, ultraviolet is a light, infrared is a light, radio wave are light. They all have the same characters, but the same character. They travel the speed of the light, and they have a wavelength and they have frequency. But for human eyes, we see only 400 nanometer, which is the violet, to 700 nanometer, which is the red. That's the vision, our vision. We see that, and most of the laser we use, they are in the visible and infrared in dentistry. So in some other medical practice, they use excimer laser, which is ultraviolet. But in dentistry, most of our laser are be used in the visible or infrared, and most of highly powerful laser, they are in infrared and far infrared, like CO2 laser. So all this light, the light, X-ray is a light, gamma ray is a light, but they have different characters because they have different wavelengths and different frequency, and they different energy. So this is electromagnetic spectrum. You should the tiny part we see is the visible, but there is infrared and there is ultraviolet, there's X-ray, there's gamma ray, and there's longer waves like the infrared and microwave and even radio wave. Radio wave can reach kilometers and more kilometers the wavelength, while the X-ray, they are small as the atoms, and that's a so the new theory about the light has velocity by 300,000 miles per second. The light has amplitude and has wavelength and has frequency, and the basic equation of light is the speed of light is multiplication between the frequency and wavelength. So whenever the wavelength is higher, the frequency will be lower. So that's why you have different energy and different characters. The nature of light started in many long time ago. In the Sumerian and Babylonian, they thought about light. In the Baghdad for 700 years was the capital of the world, and all the scientists, the mathematician, the teachers, they go to Baghdad. One of them, the major, is Ibn al-Haytham. Ibn al-Haytham, he was born in Basra, but he went to Baghdad. Then he was he was working in one of the emirs in Egypt. But he started to study, and he put a book called Kitab al-Manzar or Mandar, which is like optics, and he also proposed the use of camera. He proposed he made the dissection of the eye. He made big discoveries at that time. Most of Europe, they have the knowledge from the Greek. The Greek, they thought the eyes will give rays will send rays to the object and they can see it. But Al-Kindi, he was born in Baghdad in 700. He proposed that no, the light comes from the sun, reflected on the object, and go back to the eyes. Ibn Suhail, he discovered the laws of refraction and reflection. After like 500-700 years, snails is a European scientist. He put the snails law now with the refraction, and it's long time ago. It was discovered in Middle East. They use the the mirrors, and they use the lenses, and these knowledge that's accumulated step by step until in 1860. There's a Scottish mathematician, James Clerk Maxwell. He did math. He did the this equation. It's called Maxwell equation, and he proposed that light composed of magnetic field that stimulate the formation of electrical field, and the electrical field stimulate the formation of magnetic fields. So both of them, they propagate in one direction and they're perpendicular to each other. So this is the proposed theory of light. What the light is? It's electromagnetic radiation. Maybe one of the student, maybe in the future, we think maybe discover something else, because this is only in math. This is theoretical science. They didn't see it. No one can see the light. So it's just a theory on that. He also, based on Maxwell, he proposed the spontaneous emission. Spontaneous emission, when you stimulate an object, he said the atom composed of nucleus, and there's electrons goes around in a certain levels. So when you stimulate that atom, the nucleus will, the electron will go higher level, but the atom will be unstable. So the electron want to go back, and when you go back, will release the different energy in a phase of photon. That's what we call spontaneous emission. Spontaneous emission, that's regular light. When you heat a metal, it'll become red. It will emit red, visible red, or heat. That's when the energy put it in that metal will change to light. On this equation, Albert Einstein in 1916, he proposed there's another option, there's a stimulated emission. If the atom is stimulated, one atom is stimulated, and you hit it with a photon and the same energy and the same wavelength, the atom will relax, but will emit two photons in the same energy, the same wavelength in one direction. If these two photons will hit another one, they make three and make four, and they stimulate. So the proposed in the future, after 50 years of that, Mayman, he made two mirrors, a crystal of ruby crystal that has the mirror will make the photon goes and come back. They stimulate each other until in the end, one of the mirrors is partially emitting, and you will release laser. So all these theories until Charles Townes in Columbia University, he made the first maser. Maser is the microwave amplification by stimulated emission of radiation. So technically, he's the father of laser, but he made the microwave. The microwave is not visible; no one can see it. So that's why he didn't get the attention. But he made the basic principle of the laser. So that's after 3 years, he came Theodore Mayman. Mayman in 1960, he made the ruby crystal. He polished the edge. Ruby is scientific ruby. He polished the edges and made them like mirrors. And he stimulate the ruby by flashlight. And in the end, he has a pulse red laser. So it was the first laser was ruby laser. Then after that, they found the helium neon laser. After that, they made the CO2 laser. CO2 laser was very strong, have power energy. And after that, and the YAG laser, rubium YAG, and comes the laser. There are many lasers. And the last, it's diode laser. Diode laser, one of the the cheapest non we can use it. The light, you remember when you do laser pointer, is a diode laser. So the laser, because the light, the energy, it's focused. So you can transmit the energy to one point, and the energy will not gonna be lost because it will be focused, it will be the same wavelength, and you will have different options when you use laser. Laser cannot be found in nature. You have to make it. So there's many difference between sunlight versus laser. The sunlight have multiple wavelengths. We can infrared, ultraviolet, red, blue, green, while laser is monochromatic. If you use CO2 laser, it's an infrared. in the far infrared. If you use helium neon is red laser. Argon is a green. So it's monochromatic, one color, one wavelength. While the sunlight is non-focused, unorganized, incoherent, low intensity, because it's the energy will be distributed everywhere, while the laser is highly focused, more columnated, organized. So we have about 100 million or to billion watt per centimeter. So the energy will be focused, and it made, when the laser was made in the 1960s, it was a solution look for a problem. They use it in industry, they use it in the army, they use it in military. Then start doing it. They start find it's very effective in certain a certain part of the medicine, like in the eye. When the laser came in the ophthalmology, they can do surgery on retina without damaging the eye. They can do correction of the vision by they do excimer laser, and they reshape the cornea. So the laser made a revolution in some in some part of medicine, and then they start having it in dentistry. It is slowly, but it's growing, and we have more and more laser used in dentistry. So that's the difference between laser light, which is monochromatic, same one color, directional, coherent, while the ordinary light, it's a multi wavelengths. It's distributed everywhere. So this is another description of a spontaneous emission. Spontaneous emission happen every time, but the proposed was a stimulated emission. Stimulated emission, when one photon stimulate an excited atoms, it will end by, we have two photons. When the two photons stimulate another atoms, and we have three photons. And if you see, I have this is the laser medium. You have two mirrors, and the photon goes and come back, and they stimulate each other until we, in the end, one of the mirrors partially reflective. You will have the end laser. So this is the medium they call the optical resonator, where's the laser medium put there. A laser medium can be gas, can be liquid, can be solid, can be semiconductor, which is diode laser. So this laser component, the laser active resonator, they put the active medium, they put it in the resonator, or called optical cavity, and they stimulated by, like helium neon, they stimulated by flash lamp. Diode laser stimulated by electricity. Ruby laser stimulated by flashlight. Erbium YAG stimulated by flashlight. CO2 laser stimulated by flashlight. And that's, in the end, you will have laser. This is a picture of diode laser. This is a helium neon laser. And this is Erbium YAG laser machine that's used in dentistry. All the laser machine, it will make heat. So in the part of the machine, should we have a cooling system? We have controlling panel. Control the new machines like diode laser in dentistry has in the control panel. If you want a gingivectomy, it's already calibrated, and you will tell you how much power you get, how much pulse you have, and pulse them. So the new machines, they have reprogrammed what are you gonna do: gingivectomy, frenectomy. If you want to do the re-sterilization of the root canal, all these are pre-programmed in the new machines. And so the important terminology for laser use, like energy, the ability to work, how many joules you do, the Florence, how much energy per area, the power, the power density, the power per area, the watt per centimeters, and the beam size. The smaller the seam size, the more concentrated energy. If you want to do one incision, you have a smaller beam size. If you want to ablate a bleeding area or ulcer, you make a larger beam. So this setting for different procedure, like bulk capping, you need very lower power. and you need lower pulse, and the pulse length about 5 milliseconds. Bulbectomy, you need high power, you need but the same pulse. For gingivectomy, you need high power too, because you need to cut the gum. For excision, you need high power, and also we need to know what type of laser we're using. And so the delivery system for each laser have different type. Most of the laser visible in the near infrared, you can transmit them with fiber optics. Nd:YAG, diode laser, they have fiber optics, and fiber optics have different tips, and they have 200, 300, and 400 microns. And the smaller they are, they have more energy. The wider they are, the energy will distribute it. While the CO2 laser will be in the far infrared, cannot be transmitted by fiber optics, so you need articulating arms. Most of the laser that we use, they are infrared. So we need a visible laser. So there's always an aiming laser. There's aiming laser, a different type of laser, low power energy laser. It comes with it shows you where's the cutting, where's the laser beam is coming. This is a diode laser. This is Picasso. It's very common. It's about like, I think, $12,000, and you can use it for gingivectomy, frenectomy, for root canal, and there's other lasers. This is the Erbium-YAG laser. Erbium-YAG laser, one of the most expensive, but Erbium-YAG laser absorb in water, so they call it all tissue laser. When it absorb in water, all tissue contain water. The gingiva, the enamel, the dentin, but they are different consistency. So when you cut dentin, it's different when you cut enamel, because dentin has more water than you cut the enamel. And there's a carious lesion. Carious lesion, in general, has more water than normal tissue. So if you make modulation of that type of Erbium-YAG and make the energy would be absorbed only in the carious lesion, it will ablate the carious lesion and will stop when it reaches the enamel or dentin. And also you can change the power. So you have to know what tissue you're going to use. And also Erbium-YAG has an fluorescing ability. So when it reach when you do it for periodontal cleaning, when it reach calculus, it will send fluorescing back to the laser to send a laser, Erbium-YAG laser, infrared laser, to remove the calculus. And when it reach a clean cementum, it will stop because that has a fluorescing or diagnostic ability. Also, there is a fluorescing technique we can use it to diagnose decay. The CO2 laser, it's emitted in the far infrared. CO2 laser absorb in water. So CO2 laser is one of the best cutting laser used. Oh, and this is the main picture I want you to show you. This is very important picture. This is the all tissue will absorb light, but they absorb laser energy, but in different coefficient. If you see the visible lasers absorb in melanin and absorb in hemoglobin. So if you have, imagine if somebody came to you has hemangioma. You don't want to damage the skin and use the laser that be absorbed only in hemoglobin, where is the blood vessels. So you can use argon laser because it's a green and visible, so to absorb in hemoglobin. Well, if you use CO2 laser absorb in water. So if you want to remove hemangioma by CO2 laser, you're going to burn everything because everything going to be has water. Erbium-YAG, it's in the near infrared, but absorbing water, but has a pulse. So you can use it to fine cutting of tissue. Nd:YAG, one of the earlier laser used in dentistry, it's absorbent protein. So all tissue has protein, but also Nd:YAG has scattering effect. If you have large, I want to do ablation of all tissue of ulcer, you can use Nd:YAG. Diode laser, one of the most common use in dentistry. Diode laser, it's almost near the Nd:YAG's absorbent protein and melanin and hemoglobin. So that's why you have to know what's the absorption of these they call them chromophores. Chromophores, the collagen, water, melanin, hemoglobin. These chromophores, they absorb different wavelength and different coefficient of different and a different energy. There's another this is important slide. The tissue that's laser tissue interaction. When the laser hit the tissue, the laser can be transmitted, go through the tissue without absorption, can be reflected. I have one of them, my friend, he was working on the left and the lower side, and laser gingivectomy. After 2 days, the patient came back, and she has an ulcer in the palate. And because he used a mirror, and there's reflection of the laser go to the palate, and the patient has an ulcer in the palate. So that's a reflection, can be reflected, that the laser can be reflected. Can be scattered. Imagine we have one of the effective laser, it's pain stimulation and pain reduction and biostimulation. So if you have muscle spasm, if you have TMJ problem, one of the option for laser can reduce the pain for the TMJ, can be do by scattering, go all the tissue and stimulate the tissue to make more muscle relaxation. Absorption, that's when we use it when we need to cut the tissue, when the energy of the laser go to the tissue. About 90% of the effect of laser is heat, is a thermal effect. And by the way, transmission, the tissue will go through the tissue. The laser will go through the tissue without damaging it. I told you the example of hemangioma, or nowadays tattoo removal. People with tattoo, they need to remove their after they don't like the tattoo. When you can use laser, that it's not going to be absorbed by the skin tissue. It will absorb only by the pigment. And that type of laser, you can use a diode laser because it absorbs in the darker tissue, and darker chromophores, which is like the tattoo. Or we can use it for a hemangioma. Like if you have a hemangioma blood vessels, hemoglobin. So if you have a patient with massive hemangioma, you can use that laser. The laser will transmit it through the skin without damaging the skin, but will be absorbed in the hemoglobin, where's the blood vessels there. That's another illustration about scattering or reflection or transmission and absorption. Most of the effect of laser, and about 90% of them, is heat. So whenever the tissue has laser, there's temperature change. At the temperature change between 37 to 60, there's no visual effect, but there will be warming hyperemia. Between 50, 65, coagulation. Sometimes when we do laser surgery will coagulate the blood vessels, also coagulate the nerves. So we will have less postoperative pain, less operative swelling, less postoperative edema. About 56 to 90, we have denaturalization of protein that will have damage. If you want to damage, if you have an ulcer, if you have a tumor, you can use denaturalization. For 90 to 100, that's why we'll have the boiling of water. So when you have all the tissue have water. So whenever and when you imagine you have dentin, they have water. The water gonna boil inside the crystal hydroxyapatite crystal, and the crystal will explode. So we have you will end to be cutting that tissue. And so that's another example of temperature warming between 37 to 60 centigrade, welding with 60 to 50 coagulation and protein denaturalization, drying, vaporization, and carbonization. Usually to avoid carbonization damage, especially when you do gingivectomy, you shouldn't reach the bone because you don't want to damage the bone, especially when you do implant future, or you want to do damage if you're doing a gingivectomy for crown lengthening. You don't want to damage the bone. Carbonization is contraindicated and should avoid it. But sometimes when you do frenectomy, you want to make a scar so the frenum cannot be back. So carbonization in the frenectomy, you need to do that. So this is most of the dental laser can be used. Alexanderate, it's visible in the visible spectrum. Helium, neon, and gallium, these are in the visible spectrum. Where the near infrared, these are erbium YAG and erbium crystalline YAG. By the way, YAG is yttrium aluminum garnet. Is the crystal where you can put the active medium. So NdYAG is neodymium. It cannot be. It's not transmitted the energy source to it until they put them in the crystal. The crystal is called YAG, yttrium aluminum garnet. So many of laser names you can see there's YAG, but CO2 laser is a gas laser. So these factors you should know about: the wavelength, emission mode, power value, exposure time. Exposure time, the more exposure, you will have more damage or more energy, more power. The laser can be pulse. I have another slide about pulse or continuous. Continuous, the energy will be continuous. Most of the tissue, when we try to cut, we need to cut the energy of the duty cycle will be pulse. And you want to damage only the tissue you want to cut. You don't want to damage adjacent structure. You want to do gingivectomy, cut all the gum. You don't want to destroy the attached gingiva. You just cut the free gingiva. You don't want to damage the crystal bone. So all these you have to know about the training of laser. It looks difficult, but once you learn about the physics, how to use it, it's a little bit different from when we do scalpel. A scalpel, we have the tactile sense. Scalpel is much cheaper, but laser has more advantage. When you have less swelling, less edema, you have will be. Yeah, when I do gingivectomy with my scalpel, it will take me a few seconds. While when you do gingivectomy with laser, it takes more time because we want to cut the tissue and make sure the tissue is cut and there's no bleeding and there's no damage to that. The laser can be continuous, but no one uses continuous unless we do. Example, we do sterilization of root canal. When you do sterilization of root canal, you want to kill all the bacteria. You put the laser probe inside the root canal and give you continuous laser. The heat will be continuous with higher power and kill all the bacteria. And it's very useful. It's much better than when using a regular sterilization of the root canal. But most of the laser should be pulse. But most of the laser energy can be by flashlight, like CO2 laser or erbium YAG laser. It's pulse, originally pulse. But sometimes, like diode laser is not pulse, so they do gated. Gated, imagine like you have a source of light and you put the fan around. On top of the fan will move, will gate that laser. So the gated will have more duty cycle than when we do real pulse. So that's why when you use erbium YAG, it's really pulse. You rarely will have carbonization of tissue or damage to the bone when you use erbium YAG. While when you use diode laser, you might, if you're not careful and you put too much energy, you might damage the tissue, the gingiva, and you might damage underlying tissue. And there is a concept we should know when we work laser: thermal relaxation time. Each tissue have relaxation time. It's the time need for tissue to lose heat from the pulse of laser without damaging adjacent structure outside the laser. I have a picture when they do continuous laser on the tooth. They burn all the tooth. That's a continuous laser. You cannot use that. While if we use pulse, we can cut it like this. We can cut it without damaging structure, pulse by pulse. I know laser on hard tissue didn't replace the handpiece, but in the future, when you have special absorption, like when you said I told you about when you want to cut dentine or you cut enamel, and you can change the energy, modulate the energy, the laser will cut all the decay or carious lesion, and once you reach dentine or enamel, there will be no cut. It will stop. And that's a sectional electron microscope of the laser damage to the enamel on dentine. So the clinical application of dental laser, you can do low intensity laser. You can use it for soft tissue management, muscle relaxation, even when you do TMJ problem, and you can do hemostasis and coagulation, or if you have hemangioma or bleeding there, you can do whitening of teeth. Low laser intensity laser, we use it after wisdom tooth surgery. We use low intensity laser after wisdom tooth surgery. It will reduce the swelling and the edema after wisdom tooth surgery. It was very effective low level laser therapy, and we published that article. The high intensity application we can use it for bacterial decontamination, soft tissue ablation, cutting, enamel ablation, dentine, osseous ablation. When you expose implant, you cannot use electrosurgery when you expose the implant, but we can do it with laser. Depigmentation of melanin, we do phrenectomy, gingivectomy, if you have a impacted tooth and you want to do orthodontics and you want to open a tissue, will be very useful when you use laser because you have less bleeding, less edema, and less pain. So how to select the right laser device? Technically, most of the dentists, how much the cost of the laser, but the laser is getting cheaper with time. The laser, and you should find a good company, because laser is a machine. You cannot fix your laser. You can fix your handpiece or turbine, but the laser when you buy laser, you have to buy it from a real good company that has service, and it's very expensive, and so you need to you have a budget, and you have to know the company, and you can call them if you have problems. That's very important. So the dental laser can be surgical, hard tissue like erbium lag laser or CO2 laser, soft tissue laser like diode and diag, and also CO2. The non-surgical laser can be diagnostic of caries, detection of calculus in the periodontal pocket. You can use low level laser therapy for stimulate healing. And you can do photo activation, disinfection, all these laser curing light, all these can be used as laser. So when you have laser, especially if you have laser which is invisible, how do you know there is visible light, but this is not the active beam. The active beam, you can use articulating paper, and we see the damage on the articulating paper. You can see how big the focusing point, where's the laser. So when you do gingivectomy like that, and most of the laser, sometimes they need the suction because you suck the smoke, and sometimes some laser they use water to reduce the heat on the temperature on the adjacent structure. Also, the focusing of the laser. If the smaller spot side, the more energy will be in one side. So when you have larger spot side, when you do for aphthous ulceration, you need a larger focusing, larger defocus beam. Well, when you do gingivectomy or sphenectomy, you need a smaller focus beam, so the energy will be will be focused in one area and without damaging the structure, just the area that we want to cut. This is the wavelength of different type of laser. Argon laser would be the green, potassium, titanium phosphate, KTB, and the and the visible helium neon is red. Diode laser around the red and infrared, and the YAG. When you said 1,000, it's in the infrared. Helium YAG. This is in the far infrared. So all these, when you know the wavelength, you know where is it, where it's going to be visible, and which tissue can absorb that. That's why you choose. I want to do gingivectomy. I can use CO2 laser. CO2 laser is a very expensive laser, but it's best cutting laser. But you can modulate the diode laser. Diode laser can be absorbed by protein, can be absorbed by melanin, absorbed by hemoglobin. So diode laser is good, but have different characters when you use a laser that be absorbed in water. That's different type of lasers and their wavelength. And when we do the clinical procedure, like KTB, we use soft tissue surgery, whitening. Diode laser can be soft tissue, sulcular debridement, whitening. We can use it for root canal debridement. And the YAG, we can use it for, because the Nd:YAG is absorbed by protein and has scatter, so we use it for debridement and assist in attachment procedure. Erbium YAG is the future. I worked in Erbium YAG, Cavo Key Laser. Cavo is a German company. Cavo Key Laser has mostly periodontal and surgical laser, and it's very effective. It's also expensive laser. CO2 laser is one of the best cutting laser, but I don't think it's available. But it's very expensive. But it's one of the best cutting lasers. Diode laser, semiconductor diode, it's the future because it's cheaper and they can change it. And now they have a green laser, diode green laser. You can use it for low-level laser, and you can use it for simple gingivectomy. And this is, I think, this is another way about the list of the laser and their wavelengths. This is the diode laser, one of the cheapest lasers available in dentistry. And Erbium YAG laser is more expensive, have more advanced. They have different tips. They have different tips. Like if you have a periodontal tips, different from surgical tips. If you have root canal tips, they're more small. They use it. So when you buy the laser, you have to buy the handpieces. Usually comes with the handpiece and different tips, different fiber optics tips, size. This is a picture of a labial sphenectomy. That's before. So when you cut it, there's no bleeding, and you have less damage to the tissue, less edema, and you have because it will seal the blood vessels, also will seal the nerves. So we have less swelling, less pain. This is lingual sphenectomy. Can you see that contact tip? That's fiber optic tips, and how the lingual sphenectomy, and this is tongue tie. This is gingivectomy. That's a crown lengthening procedure. This is the first few days, and within a few days, you can see the healing is much better because it's uniform, and we have less swelling and less bleeding. This is a stimulation of TMJ by temporal muscles and sternocleidomastoid muscle, the TMJ. This is one of the way for low-level laser therapy. This is another gingivectomy crown lengthening procedure by Erbium YAG laser, and this is the wavelength of the laser. This is gingivectomy cavity preparation and water lays. Water lays, one of the most common used now in dentistry. Water lays. There's a big company, they can come and show you how to use it. Water lays. This is pulpectomy and gingivoplasty. You can do it in the laser too, especially in children, because there is no vibration. There will be no bleeding. So the children, it's very effective if you are video dentist or if you work with children. Laser is very good when you use there, and there will be. It's different when you use the handpiece and the vibration for children, but with laser there's no no vibration and less bleeding and less pain too. This is exposure of impacted canine. So you can see when the palatally impacted canine, you can see there's less bleeding and the tissue will heal much better than when we use a scalpel. Although it's more expensive, but it's the future. You should learn. I think most of the dentists should know about that. This is ablation of if you want to. This is fibroma, and this is how you use laser, and you can see the cut. There's no bleeding because it will seal the blood vessels when you cut it. Okay, we need a lecture about the laser safety. Laser safety is a big deal because laser it's a light, so the patient should wear special glasses. The dentist and the assistant, they should wear special glasses, and you should have like a course of laser safety, at least a few lectures about laser safety before you use laser. But in general, you should have a precaution of laser. Laser, it has a lot of benefits. Have less bleeding, less invasive, more precise, less painful, better healing. Wow effect. Most of the patient will love if you have a sign. I'm work with laser. The patient will love it because it's the future. It's technology. When you have digital scanner, the patient will love it. When you have digital 3D printer of CEREC machine, the patient will love it. So this is a good thing. But also there's disadvantage of laser, but there's drawback of laser. It's expensive, overestimated advantages, need biophysical training. You need to not only medical biology, you have to know physics, a little bit physical absorption of that laser. We have less tactile sense of surgical tools. When I use the surgical blade, I feel when I cut the gum, I reach the periosteum, I reach the bone, I feel it. When you use a laser tip, it's different feeling, but with time you will learn. Within in the training we use for our student, we give them a sheep head, and they do the gingivectomy on the sheep head, and they will learn how to cut, and with time they will learn until they will learn how to do work on a real patient. But even we can start with the gingivectomy. I want to do crown. And just be careful, and with the precaution, you will learn a little bit. But the laser is the future. I'm telling you. Thank you very much. I appreciate your time, and thank you for inviting me again.
Okay. Thank you very much, Dr. Saleh Jany. Please give a big applause for Dr. Saleh Jany, although it is online, but your presentation was excellent, magnificent. It is still new in Indonesia, and I don't think we have company with provide cutting laser, but lower intensity laser we already have for the TMG problems, but for the cutting, I think I don't know. Maybe
next time I will come. I'll bring one. I'll bring the diode laser because it's not very expensive. So I will show you can do the gingivectomy stuff.
Okay. So we continue to the next session, maybe for the Q&A session. Please, from audience, if you have questions or something you still don't understand, or you want to ask more for Dr. Saleh Jany, please be welcome to ask some question or give your experience about using lasers or something.
We can use laser sleep apnea. We can you can recontouring the soft palate, and you can open it because you can when you recontour the soft palate, the snoring, And you can do it with the blade, but when it was bleeding and it's very painful. But when you use it with laser, there's less bleeding and less edema, and it's made a big deal when the sleep medicine. I told you one of the big things is sleep medicine nowadays, especially in Western countries, because we have the sleep apnea disease, and we can use the sleep devices. But now with laser, you can do surgery on the soft palate and make the breathing much better, and you have less snoring.
Okay, thank you, Doctor. Any questions from the audience? Maybe I want to ask something, Doctor. I'm all products. Yes. My teacher said that scalpel or blades is better for the healing. It produces less scars than the lasers, than the electrocoagulation. What's your opinion about the blades is better than the electrocoagulation or the lasers?
All the school, we love the scalpel because it's cheaper, and we train on it. But I tell you, it's the future. I remember I told you now every dental office they have a lighticure. But I think within 10 years, every dental office they will have a diode laser. Okay, but it need a little bit knowledge, because I'm using this energy, and I have two parts of the tissue. The medial side inflamed, and the distal side is not inflamed. The inflammation, you have more water, and if you use the energy level will be different when you use erbium because it absorbs in water. So when you use inflamed tissue, you will have less energy. You need less energy than. So it needs a little bit of training, but the laser, when it cut, it will coagulate the blood vessels. It will coagulate the blood vessels. Also, will coagulate the nerves, and that's a thing. You have less swelling. Even the lymphatic tissue. All tissue has lymphatic tissue, very small, minute lymphatic tissue. And that's when we have swelling and edema after surgery. So when you coagulate the blood vessels and coagulate the nerves, you have less swelling and less. But depends on the operator. The training of the operator. And when I use scalpel, it would take me a few seconds to do the gingivectomy or when you do open incision. But when you laser, it will take a longer time, but it'll be less, it's more precise, and we have less bleeding.
Thank you very much, Doctor. Any questions, audience? Please. I know it's quite new. If you want to ask in Bahasa, maybe I can help you to translate it. But I think the students is quite familiar with English now. Any questions?
Thank you. I have a question for you, or for the student. Why the sky is blue?
Okay, pardon me, Doctor.
Yeah, the question for the student. Yeah, why the sky is blue? Anyone? Why the sky is blue?
Why the sky is blue?
Yeah.
Okay, because it's reflection.
It's a scattering. The light is it's scattering. Yeah, the light will scatter in the blue. Remember, the sun, it's white, but when we see it when it's sunset, it's yellow. Why? Because when we see the sun, the horizon is very longer, and there's dust and particles, and the light will be scattered. The blue will go to the sky, will give the color of sky, and the red and the yellow stays. That's why we see yellow and red. That's why when we do traffic light, we use red because it's more visible when there's a scatter. When there's dust, you can see more red than blue. That's why.
Okay, there's a question, Dr. Saleh Jany, from Dr. Dewi Zakiawati. Can you share your experience, perhaps with oral medicine specialists, the cases that related to oral medicine, such as an oral cancer, maybe?
Okay. Okay, a laser with oral cancer because is not going to use very good in oral cancer, because when we do oral cancer, when we do removal of the edges, we need to do a biopsy so we can see if the laser we would like 2 centimeters around the cancer. And when they send them to the biopsy, so you can see if there's a cancer tissue past the margin. With laser, will damage all the tissue. So in laser, sometimes we do debulking. If you have a large mass, you do bulk it by laser, and then you remove the extra by scalpel or the different machine. But in laser for for cancer, mostly we use it for debulking. But laser is good when you do hemangioma and vascular lesion. Vascular lesion, because it will coagulate these tissue, and that's
okay. So in conclusion, that if you want to do biopsy, you better use the old-fashioned one. Yeah.
scalpel, yeah.
Yeah.
But when we work with vascular lesion, that's a big deal. You need the laser. So laser didn't replace. One thing, laser didn't replace the traditional equipment in dentistry. It's give you more options. That's why you need a laser to put it there, but you don't use it for everything. But you need it in certain time, like sterilization of root canal. It's very good. The sterilization for root canal, it will kill 1,000 times more than we do. They do the hydrogen peroxide. So it give you more option, give you more possibilities. That's the thing.
Okay. Okay, there's more questions.
You're welcome, Eris.
Okay. Are there any questions?
Diesel therapy, because several benefit obtained from using laser. Yeah, I told you, laser can be used in many options, because verticile, and it can be diagnosis. We can diagnose if they have calculus in their gum. We can diagnose if there's a decay. So laser, it's a new option, a new opening. So it will not replace the turbine or the blade in the time being, but will give you more options for the future. Electrosurgery, we cannot use electrosurgery when you expose implant, but with laser you can do that. Because it's metal. With laser, it's it's fact. If the lesion is too far away, like I told you, in general medicine, the laser in ophthalmology, it's great. In a tumor, and like you said, imagine you have tumor in the brain, and if you add a special pigment that will absorb only in the tumor cells, and this pigment will absorb the energy of laser. That will be perfect, because we're going to damage only malignant cells without damaging normal structure. That's one way of is one of the way of using laser.
Okay. So we still need the old stuff, yeah, doctor.
Yeah. I told you, laser didn't replace the old stuff.
This is the future.
It give you more options and give you more. In Middle East, we use a lot of laser now. It's available in Dubai, in Iraq, and Baghdad, and Doha. Yeah, most of the people, they use laser. It's a bit more expensive, but it's the future. In the United States, most of the offices, they have diode laser because it's not very expensive.
There's one more question. I've read laser also disinfect the surface and coagulate bleeding. Okay, I think Dr. Saleh already explained it, but if you want to explain it more, Doctor, disinfect the root surface for root lining, maybe, Doctor, and
yes. You should search rubium YAG, Cavo rubium YAG laser, called Cavo key laser, they call it. It has a fluorescing technique. It will you put it in it has the tips will go inside the pocket. When it goes to the calculus, will damage the calculus only. When it reach a clean surface or dentine or cementum, it will stop because it has a feedback mechanism of fluorescing. Also, all the bacteria have water inside them. So whenever there's water inside the heat energy, the aerobium, it's absorbing water. So there's boiling in the water, so the bacteria will die. So it's good in sterilization of the root canal. That's a thing. Although the Arabian it's expensive, but it's very good in period. The period did a lot of things in periodontology, periodontics in general with laser.
Okay, thank you very much, Dr. Saleh. Thank you, Dr. Fili, for the question. Any other question from the audience? Okay. Okay. I think there's no more questions. It's already late in US, right, Doctor?
No, it was a pleasure for me. Thank you very much. I really enjoyed.
It was a very very good presentation. You not only, although it was very fundamental because the terminology, you should know the terminology about the scattering, the what the transmission,
absorption,
the absorption
transmission
is very important for us.
These the new thing. Yeah, if you want to work on laser, you have to know these terms like absorption. Where is the tissue gonna absorb? Which tissue? Which tissue? Because the laser will absorb in certain tissue. Like if you use small blood vessels, if you have a small blood vessel, and you can use CO2 laser. CO2 laser would good in coagulates small blood vessel. Imagine you have a larger blood vessel or hemangioma. When you hit the outer rim of the blood vessels, it will absorb it, but the most energy will be absorbed in the middle of the lumen, will not reach the other side. So you would think I can use Nd:YAG laser, which absorb in a protein. So we'll have more coagulation when you have a larger blood vessel. So when you think these are fundamental, the absorption, the energy, it's a little bit it's scary in the beginning, but once you learn it, it won't take like few lectures. You will learn what's the energy, what's the power, the wavelength, where's the tissue gonna absorb that certain energy. You will learn, and when you have the laser, you can do that. And it's not very difficult. It's not rocket science. And you have the background of biology. You just need a little bit of physics, and you know about that, and it will be great.
Maybe we can arrange for the next session, right, Doctor? If you don't mind.
Yes.
Or maybe you can come to Indonesia, to our university, to
Inshallah,
give a short course about laser technology or simple laser technology in dentistry.
Inshallah.
Okay, I think that's enough for today, Doctor. Thank you for your sharing your knowledge. It was very pleasant for us for having you here for the Faculty of Dentistry of Universitas Padjadjaran. Maybe we hope you will able to give another session in the future.
Inshallah.
Okay. Thank you. Give a big applause for the presenter. Thank you very much. I will handle it to the Master of Ceremony, please, Sarah. Thank you very much.
Thank you, Dr. Saleh Jany, for intriguing lecture, and thank you, Dr. Indra Krishna, for moderating our event today. Let's cheer for both Dr. Saleh and Dr. Indra. As a mark of appreciation, Faculty of Dentistry Universitas Padjadjaran would like to give certificates to both of you. I will now welcome Dr. Ali to hand the certificate to Dr. Saleh Jany and Dr. Indra Hadikrishna. And to the IT team, please capture this moment. It looks like the team are experiencing some technical issue. Let's just wait for a moment for them to fix a technical issue. Sorry for the delay.
Well, Dr. Andra, maybe I'll come bring a laser machine, like a diode laser, and we can work on like gingivectomy or frenectomy, simple stuff. Maybe next time if I would come.
Thank you, Doctor. Maybe the next session is more clinical, right, Doctor? This is the first one, is the fundamentals, and the next will be the more clinical and more technical, Doctor. Maybe it's better. But the fundamentals is very important for the terminologies, the wavelength, the visible, non-visible. So you already you told us about the invisible light, but you have the guidance. The light is not the light is not the cutting, but the lights is only for the guide.
Yeah. All laser, if they are infrared, they're invisible. They have a laser guide. They always guide, and some laser have a sound, so you know when you cut. When you have the foot switch, there's a light and there's a sound, so you can know when you cut. So when you cut and when you stop, there's a light, but the laser power is stopped. That's the thing.
Okay, Dr. Indra, Dr. Sarah.
Yes, Doc. You may present the
Okay.
certificates.
Yes. Dr. Saleh Jany, thank you for your excellent presentation. Please accept this certificate as the appreciation for your excellent presentation.
Thank you, makasih.
Thank you, Dr. Saleh.
And Dr. Ali, you may also present the certificate to Dr. Indra.
Thank you very much for the certificate, Doctor.
Yes. Okay, Dr. Indra, please accept this certificate. Thank you. Good morning.
Okay.
And now, everyone, this marks the end of our today's event. And before we part, let's take some documentation. And for the IT team, please capture this moment.
Maybe first we should reveal our face.
Maybe you can help counting, Sarah, please.
Oh, yeah, of course, Doc. There are 3 slides in here, and if you want to activate the camera first, please do. And 1, 2. For the next slide. 1, 2. And for the last slide. That will be all. And I sincerely hope that you have enjoyed and derived numerous benefits from this gathering. I extend my gratitude to the honorable professors, doctors, and participants for gracing today's meeting. If there are Any areas where we fell short during the session, please kindly do provide us with your valuable feedback for our future enhancement. Wishing you all a pleasant afternoon, good health, and a wonderful day ahead. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much. Thank you all.
Welcome to the Faculty of Dentistry, Universitas Padjadjaran, with the concept of smart and green dentistry.